The idea for a therapy dog came about because the pandemic was really hard for a lot of our staff members, and I noticed we had a volunteer organization that would come in every Thursday and bring their dogs around the hospital, and even having those dogs around just for a couple minutes on the floor made a huge difference. So then we thought about what it would take to have a full-time therapy dog on our floor.
I was surprised one day a couple summers ago when Kaylin approached me and said, "Hey Tom, I have a question for you. We'd like to have a therapy dog on the floor." And I'm thinking, a dog in the hospital, I don't believe that that's something that's even possible. We found that indeed pet therapy is well known. However, one that is here every day in a hospital setting is kind of uncommon. So when I had a meeting with my leader, Linda Francis, who is our Chief Nursing Officer, and Mike Giroux, who's our Chief Operating Officer, and talked about the concept, they were very supportive. In fact, Linda had used therapy dog programs in places she had worked before. Then when we explored securing a dog, I found a breeder here locally. My sister had actually bought a couple dogs from them in the past, so I know that the temperament was good, the health was there, and when we found a dog that we could use, it's 8 months old. Now, in order to be therapy certified, a dog has to be a year old. So in the training journey, it really was a chance for Kaylin and I to work together to assure that he could have the AKC Good Citizenship, which makes him eligible for the test, and then the therapy training itself, which made sure that he would be safe in a hospital setting. So there's things like wheelchairs and navigating around something that might, roll by his tail or foot, and a lot of strange smells in a hospital setting. So what we did is we got him used to those things so that when he finally did become therapy certified, he was able to, in a very calm and relaxed way, in a confident way, being able to come into a patient's room or alongside physicians as they're rounding through the course of the day, seeing patients, and feeling very at ease when he is along our side.
It's spelled ROSC-O, and that kind of comes from when we code a patient, we're doing CPR, we always want what's called return of spontaneous circulation, or ROSC, so that's where Roscoe came from. It's really rewarding to be able to help not only our patients, but our whole team. I think having Roscoe has been such a blessing, because we always think, what can we do for our patients? How can we make things safer for our patients? But we always tell our patients' caregivers, you have to take care of yourself before you can take care of others. I think this has been really healing for our staff. They really love having Roscoe on the unit as part of the team. It makes their day when he comes down the hall. We had a staff member say today that was the best part of his day, was watching Roscoe run towards him down the hall. I just think it helps make the hard days a little bit easier.
He's all about making rounds each morning, so we have a chance to visit all our coworkers, see which physicians rounding that day, and then interacting with patients and staff. We've also found that kind of less traditional part of his day is equally as rewarding. I have many coworkers that like to see him, kids or cancer patients that like to interact with him as well. Then at the end of our day, we load back up in the truck and go back home. When he has his therapy vest on, he knows that he has a task to do and he's serving a purpose.
I think that would be great if this could spread, if every floor could have a Roscoe. And I know Parkview's already started a Parkview Pups program. Their coworkers can get their dogs certified as therapy dogs, and so I think it's already starting to spread throughout our system. So I think it would be great if nationwide hospitals could start having inpatient therapy dogs.
Within the Heart Institute, it's not about our job or our task. It's that sacred trust of taking care of patients and just creating an environment that's healing. You can tell that he's excited to be here. And I love creating a work environment where people are excited to be here, and Roscoe really fits into our culture as well.